Hi, everyone, and welcome to the Thrive Co-Living Communities YouTube podcast. I'm Mark Stein, Thrive founder and your podcast host. We're creating sustainable, inclusive, and multi-generational residential communities. Our mission is to combat the epidemic of isolation, revitalize communities, and help others discover the many benefits of engaged community living by offering unique and ecologically sustainable co-living options. In this podcast series, join us as we discuss co-living, in addition to bringing you interesting people from around the world who are doing cool things to expand your knowledge and satisfy your curiosity. Through this podcast, learn more about our concept and see how Thrive co-living communities will bring together people from all walks of life who want to enjoy the best of independent and group living. To find out more about us, please visit our website at thrivecolivingcommunities.org. Thanks for watching and enjoy the podcast. Hi, everybody, and welcome back to the Thrive Co-Living Communities YouTube podcast. I'm happy to have Dr. April Wang back with us today. You may remember that she was on before. She's a doctor of acupuncture, and we'll talk a little bit more and remind you about her background. But we'll put a link, no, it's going to be here. We'll put a link to her last video up there, and you can click that and get a general overview about acupuncture from that. And we're going to dig deeper today and talk about long haul COVID and some of the other issues that her patients present when they come in for acupuncture treatment. So Dr. Wang, welcome back.
Hi, Mark. I'm happy to be back.
Great. So remind or for new people tuning in, tell them what your background is in terms of your medical training. It's very impressive. So please share that.
Okay. Yeah. This is Dr. Wang. Originally, I'm from Beijing. I got my medical education in Beijing University of Traditional Chinese Medicine. And I have been practicing for 32 years of this alternative medicine. Actually, the first 10 years was in Beijing. We practice both medicine. Because we are licensed in contemporary medicine and the traditional Chinese medicine. So I was working in a big hospital. We use all the modern methods to make diagnosis, but come to the treatment, we use alternative first. If Chinese herbs and acupuncture not strong enough, then we use real chemicals like in the United States, the MD do. And after 10 years working in Beijing, I came to United States, and I've been practicing in Pinellas County for how many years? 19 years now. And I see a lot of patients with all the different situations, but most commonly different pain. And today, that's why I want to talk with Mark today. I just want to let people know acupuncture is not only for pain. We can treat many other disease, other internal disease, and is a very wide spectrum alternative medicine.
You're also married to a doctor, aren't you?
Oh, yes. My husband is practicing endocrinology in Morton Plant Hospital. And actually, he has been Western medicine doctor since day one. So he got his education in Beijing as well.
And you're located in St. Petersburg, Florida, Tampa Bay.
Yes, yes. My office is in St. Petersburg, Florida. And I like the location. I like the people there. So I'm very happy to work every day.
You know, it's a feels like a very, I've been living in the area for about 2 years, and it feels like a very open society, and people are very welcoming and open to new ideas. I see a lot going on in terms of alternative therapies, yoga, Pilates, lots of alternative things going on here health-wise.
You are
So
very right. You know, I agree. I agree. It's very lots of varieties. People have open-minded diversity.
yes. So we're going to start out and talk about this new phenomenon called long haul COVID. And it's happens to a small percentage of patients, I believe, who have extended and sometimes very severe symptoms. So first of all, why don't you talk about these symptoms that are typical with long haul COVID?
Okay. With 3 years pandemic passed, right now we see lots of patients still have symptoms after COVID, long time after COVID. We call that long haul COVID. And it's not a small amount, a big percentage of people have the problems. The typical symptoms, it usually happened after COVID, usually 4 weeks after COVID diagnosis. If people still have the symptoms and some last months, we call that long haul COVID. The first symptoms people complain the most is fatigue, unexplained fatigue. And we have some numbers here, about 15% to 87% people complain fatigue after COVID, and it lasts more than 2 months. And another one is short of breath, especially when people doing daily activity like house activity or even short walk. They experience short of breath. This is 10% to 71% people have that. The third one is chest pressure. There are about 12 to 44% people complain chest pressure after COVID. And there are another 10 to 13% people complain lost smell or lost taste. And another major problem right now we see more and more is about 30 to 40% of patients after COVID experience brain fog.
Say it again.
Brain fog. They cannot think clear, cannot focus.
Can it be retroactive?
No. And
sorry, go ahead. I've been in a brain fog for many years, so sorry.
Yours might be not COVID related, right? And another two common symptoms is coughing, the dry coughing, and the joints ache. So you see lots of different systems involved.
Okay. I've got a couple questions here. So I made an assumption that sounds like it might not be correct, that only a small percentage of people who have COVID experience long haul. Do you have an estimate of what that percentage is?
From what I see, I will see at least 30 to 35% of people. Okay. Yeah, my patients.
Wow. Of course, you're not seeing people who are not experiencing it, so that may be hard to really gauge. But anyway, so
But I do have some patients. They got COVID, then
Okay.
then they told me right now they are kind of totally recovered.
Okay. Um, is are the symptoms with long haul COVID related to the uh, the amount of symptoms that they had during COVID? In other words, if you had a really bad case of COVID, are you more likely to have long haul, or sometimes does someone with minor symptoms end up having long haul COVID and maybe even worse symptoms later on? Is there any correlation between how bad
Yes,
it was before?
yes. The statistics shows the more severe you have COVID in the acute stage, the highly possible you have long haul. But I do have some patients recently they got Omicron, which is never severe, but they still experience after they test the negative, they still have the long haul symptoms.
Okay. And then the other question I have at this point is how much of a relationship do you see between the general health of the patient before they got COVID and the severity or the likelihood that they're going to have long haul COVID? You follow me? Is there a relationship between their
Yes,
health and
right,
chances?
right. Um, I would say if some people have pre-existing conditions or people have adrenal fatigue, which is lots of people from a long time stress, being stressed, they are kind of highly possible to have long haul symptoms.
Okay. So not necessarily their general health, but stress would induce it and induce
I
worse
would say
symptoms.
yes.
Okay. So anything else about how people present with long haul? Anything else on that front end before we talk about the treatment?
What do you mean present?
Well, how the symptoms that they complain about. You've talked about what they are, but I just want to be sure that there isn't anything else about how they come to you before we talk about how you treat them.
They usually, the symptoms we were talking about, you have to have some conditions to relate it to COVID. First, you really got positive. You have the history of the COVID-19, and then you never experience that long time symptoms lingering, and that's how we related to. I think a lot of patients come in just say, I always feel fatigue since my COVID, feels I never recover, and I have to be very careful. If one night I stay late, I'm not sleeping well, then next day I will feel the symptoms come back again, kind of extremely fatigued for no reason. And so this kind of patients.
So obviously, you're going to treat patients with different symptoms differently.
Yes.
But why don't you talk a little bit about the treatment, and maybe if you need to say, okay, if it's about fatigue, I focus on this. If it's about coughing, I focus on this. However is best to explain it.
Okay, of course, Chinese medicine, we treat patients individually according to their different symptoms. And even some people are same complain, the same fatigueness, because their channels involved are different. I will treat differently. In Chinese medicine, First we have to understand why we have this long haul. The Western medicine just believe because of the toxins of the virus. It's still even we killed after treatment, after traditional treatment, we even killed or controlled the majority of virus, but the always some leftovers there, and so the toxins from the even the fighting our defense system to kill the virus. In the process, we produce lots of toxins, and these toxins also cause some inflammation. And if we do not have in Chinese medicine, if we do not have enough good energy to clean to get rid of these toxins, we still experience some symptoms. And in Chinese medicine, we believe this COVID-19 mainly affect lungs and spleens, these two channels. And so the reason people feel fatigue is related to the spleen organ and its spleen system. I would not say organ. When we use the word of spleen, we are not talking about organ spleen like traditional medicine. We are talking about a functional system. In this system, we the spleen in charge of muscle strength and in charge of the digestion, the absorption part, and also in charge of the water metabolism, which is very important, related to lympho system and the immune system, all the immune cells related to spleen in Chinese medicine.
So, at first, I thought you were saying skin, but you're saying spleen.
Spleen,
Okay.
yes.
Okay.
Yes,
Just
and
sure.
the spleen system. People are interested. You can Google spleen channels, Chinese medicine. You will see what I'm talking about. It's related to lots of symptoms which related to the long haul fatigue. And I talk about spleen channel, and the lungs channel in Chinese medicine was affected by the COVID virus. That's why we experience some coughing, short of breath, and even the chest pressure is all related to the lungs function. So when patients come in for long haul systems, I will focus on these two channels. If people have stress related, and I will deal with the liver as well. And because in Chinese medicine, liver is in charge of all the emotional change. Also in Western medicine, liver is a major organ to decleansing. And so that's the major treatment we have to. And also for long haul COVID, sometimes acupuncture is not strong enough. We usually combine with herbal treatment, which can help to clean systemically.
So we may have talked about this in our first meeting, but I know I talked about this earlier or in the last meeting, but I'm a patient. I come in regularly dealing with some things, and so I'm speaking somewhat from experience on how she deals with patients. So one thing that you do is that you check both wrists, almost like you're taking a pulse, but you use 3 fingers, I think, and
Yes.
you check both wrists, and
Yes.
tell us what you're checking and how you're able to tell from the touch. Tell us what you're doing.
Okay. When I take your pulse, we really call it taking pulse. But when we take pulse, we are not only count the heart rate, we feel the shape of your blood vessel and the position where the beat come from is shallow, is in the middle, or is very deep. And we also feel how fast it moves and what's the shape of it. It's wide like a river or it's thin like a thread. And also the way it touch my finger is just soft touch. It's kind of sluggish or it's hard like a wiry, like a guitar wiry. And it's all the different shape, speed, and the position tell us the different situation. And also my three fingers feel three different organs. And on your left side, what I can feel is the lungs, liver and kidney. On the right side, I feel another three is also the kidney, heart, and the spleen. So different finger. Why I do this? My three fingers this way. My three fingers just can tell different organs function through the things I just talked about, where it is, what the shape it is, how strong it is. So that's the major way to diagnose the people's health condition before we have blood work, before we have X-ray, MRI, everything.
That's just fascinating to me. And, you know, there are a lot of disciplines that are both an art and a science. And
Yes.
this definitely feels like one of those. How much of your work is art and how much is science, if you can take them apart?
Oh my God. It's hard to say. Yes, I would say it has the art in that because you have to use your heart and soul to feel it. That's why we value experience a lot in Chinese medicine, because the more patients you see, the more you can feel. It's kind of, when I take pulse, patient's pulse, it's kind of two human life communicating. I touch you, I feel you. It's not, there is a science behind it, but I would say not 100% to be understood by modern science right now. And that's why many people say it's not scientific, it's just art. And but I would say I believe there is a lot of science behind it. Right now, if you are interested, you can search lots of research about meridians, about acupuncture, even about the Chinese herbs, how they work. And now for Chinese use this kind of method to treat people, to do the people's well-being for 5,000 years. And there must be something behind it. But I agree with you, some art with that, because that's what I feel. I have been practicing 32 years. That every day I feel more. I feel I understand more of what's going on. So it's a day, I'm still learning.
Maybe you learn the science, you keep the science here in your head, and I'm asking, and then you open yourself up to the and use your intuitive skills to see the whole person, the whole situation, and then draw upon the science when you need it.
Exactly. I think it's a better explanation. Yes.
Good. It was an accident. So,
No, you really understand well.
um, let's go do a little deviation here and talk about China and how much, obviously modern medical techniques are growing or moving around, as well as Eastern techniques moving to the West. What do you see or hear? I don't know how often you go back to China. What do you see as the state of medicine in China? How much are they weighing both types of medicine? And then I've got a question about how they're dealing with COVID in China, which is different from how we're dealing with it here. But what do you see? What are the trends in terms of the balance between Eastern and Western medicine currently in China? I know it's a big country, and you can't totally generalize, but what do you see or hear?
Yeah, I usually go back to China every year because my parents are still there. And what I see is, one thing the medicine in China is different from United States is we're always trying to combine this traditional Chinese medicine and the Western medicine. We do have, I would say, majority of hospitals, let's talk about the hospitals. In China, majority hospitals are Western medicine hospitals. And I would say maybe 40% are the combination. And so the good part, I think, is a better system because, like I said, when we make diagnosis, we use all the modern method, but come to the treatment, we try the alternative things, alternative medicine first. And in this way, we are not over chemical people or over surgical people. And we just do necessarily with the real chemical treatment. And but come to the young people, the new generation, what I see is because Tylenol is too convenient, and it's easy to take and it's quick to see results. It's better than traditionally taking Chinese herbs. It's not taste pleasantly and also take time to heal. So I see it's like McDonald's. I say the not only fast food, fast medicine goes to affect young people in China as well. That's what I see.
Is there a difference between the cities and the countryside in terms of adoption of Western medicine versus continuing with Eastern?
Very good question, Mark. Yes. And in big cities, like I said, lots of Western medicine. I would say Western medicine is the majority leader. And but come to the rural area because of the cost of the hospital. When they do not have the little village, they do not have hospital, and go to hospital will take them 2 days to travel. So then they still use a lot of this traditional Chinese way, and they use herbs. Some people, even the grandmas, even can get herbs, fresh herbs in the nearby mountains because they know how it works, what is for what. So that is still a lot of practice there.
And I'm I'm guessing that a lot of doctors in the cities want to come to the West, whether it's US or Great Britain or whatever, to do training, and then some stay and some go back. So that probably has a lot to do with it as well.
That is true. That is true. Actually, my husband is an example. He works in a big hospital which established by Rockefeller Foundation, and so all the almost every doctor working there want to get some training abroad, and we call that get gold coated. that because Western medicine is where it's come from the West, so they all want to get some abroad education or training. Then they can be how to say that, they can have better or deeper understanding of where this come from, so they can better for their work.
So let's talk a little bit about the difference between how China is currently dealing with COVID and before, which is similar, where they're just saying we have I think it's zero tolerance, zero something. And this recent shutdown in Shanghai, it's like, we don't want any of it. And if we see any of it, boom, everybody stays inside. We shut everything down. What are your thoughts? What are your thoughts about that? The different, and we here in the U.S., especially in Florida, it's like, what COVID? You know, we're going to just cover our eyes to it. So, how do you evaluate the difference in how they dealt with it? And actually, it's sort of counterintuitive, I think. I would have expected China to, I don't know. Let me not inject myself in it. So what do you think about the way that each is dealing with it?
I think right now I have been in the United States for 24 years. And I really think the American way, our American way is a better way, it's a natural way. And I'm not saying we are perfect, but I compare to this too, I'm leaning to our way, because China right now is still talking about zero tolerance. I think scientifically it's not possible, because you cannot kill virus. You cannot get away from virus. Historically, human being are living with virus for since day one, and even virus existing in this planet long before human being. And their zero tolerance, I think, is more politics, because they have to have a reason to control people, and to further control, firmer control. And I think that's they're more motivated. And they even they keep saying zero tolerance right now, still cannot be zero. Yes, they have better control in the spreading, but they still cannot control people having it.
Yeah, that's interesting, because and I don't want to go too far into politics,
right?
But China is much more into controlling the population.
Yes.
And just like and it's not like it's just there. We used September 11th to crack down on phone conversations. I mean, we used it as an excuse to increase control as well. So it's sort of exerting the control and getting people more used to following orders of the central government.
Exactly. Exactly.
Interesting. And one other tangent along those lines, I follow Tesla very closely, and their factory in Shanghai was shut down totally for about 6 weeks. And then they and other manufacturers started housing people on the campus so that they're not going in and out. They're just staying together, which makes it less likely that they're going to get it. And I'm betting that, and I think that the government is flirting with another shutdown in Shanghai at the moment. And I bet you that Tesla and other manufacturers will be able to better handle any other shutdowns. They'll just bring people back. You can't leave. We'll feed you. Anyway, okay, so this is pretty far from acupuncture, isn't it? But,
I know, but that way never happened in the United States. It's like a camp. Cannot prison people. You cannot let people go home. It's really not right.
Yeah. Okay, so we'll move back to COVID and acupuncture. If there's any more to share about long haul COVID and how you're treating people. How long do we know how long this is going to last with treatment, with Western treatment, with Eastern treatment? Do we know how long is long haul COVID going to last for people? Do we know?
It's too new, and even this long haul COVID, this name doesn't come long enough. And but what I can see is people do get better, and some people really their taste come back, their smell come back after our treatment. So I do believe we can help.
Okay.
The treatment usually, I would say, lasts couple of months. I mean, take a couple of months treatment to feel better, to get rid of this leftover virus or the inflammation.
Are there any Western treatments that have been identified for long haul?
I don't think so. They just gave a name, like many situations, gave a name and come to the treatment now.
So let's talk about a few other issues that people come to you for other than pain, and just expand the discussion a little bit.
Okay. Actually, other than pain, the other more common condition people come to acupuncture is insomnia. People have sleeping problems, and some patients do not want to take the Western sleeping pills. They worry about the side effects, and some come to me because their sleeping pills used to work, not anymore. So they want to see, are there any alternative ways to help their sleep? And come to Chinese medicine, we see sleep, the insomnia, we have different problems. And some people, for the people have problem fall into sleep. And we believe you have excessive heat in the heart channel. And usually happen in the heart.
Excessive heat?
Excessive heat in the heart channel. And so people will experiencing how to say, people tell me I just cannot shut my brain off. And once I lie down, I mind starts spinning. And uh, for this kind of people, because too active in the brain and heart, we usually in Chinese medicine we have to choose different channels at different points to clear the heart fire, to make the heart cool down a little bit. When the excessive heat from the heart is diminished, your brain become easy to feel calm down, and you do not feel the restless, the spinning feeling. And another insomnia we usually see is some people say I have no problem falling to sleep, but I wake up every hour, every 2 hours, or three times, 4 times a night, and also bother my sleeping. I feel tired after the whole night. And this kind of problem we call the Chinese medicine, we will say you have yin deficiency. We call about yin and yang. The yin deficiency include your hormones, nerve conductors, and even blood. So everything liquid is we call in our body. So we have certain ways to bring the yin level up to make the yin yang balance. We talk about Chinese medicine, yin and yang. They have to be balanced. If yin deficiency or yang deficiency, they are not balanced, you will have problem. And so one of the sleep problem is yin deficiency. And the patients will feel wake up, break up sleep. And also some people say I have both. I have problem in falling to sleep and I wake up very often. In this, we call that heart and kidney stop communicating. And so I do not want to go too much into the theory of the channels and the organs relationship, but just let you know, we have the different ways to look at the problem and the different ways to treat it to bring up the balance of our body. When we talk about balance, we talk about yin yang balance. When the people have both sleep, fall into sleep problem and stay in sleep problem, we call that heart and kidney stop talking. We just have a way to make them communicate again. And so it's really interesting and also complicated come to the diagnosis and treatment. I hope you don't last.
So I think let me, in my sleep lately, I'm really busy. I am, and it's an extension of my busyness during the day. It's I'm solving problems. I'm not particularly disturbed, but how much of it is your subconscious, which is more active and activated because your conscious mind is at rest? How much of it is your subconscious working through some of these issues, whether it be the busyness and the practicalities that I'm dealing with, or let's say a family problem and a family dynamic problem. So if some of the examples are mental health related, is it bad to be active and dreaming and working out these problems subconsciously to help move your resolution into your conscious life. So maybe some of it's healthy and beneficial.
No, actually, your subconscious is very active. It's not healthy. And we are designed. See, that's another thing. I just said I do not want to go too much into the theory, the Chinese medicine theory, but I have to. See, sleeping is a process of the yin yang movement. You see the picture of the yin and yang, the yin yang ball, right? And the black part indicates in part, and the white indicates the yang part. You can see they are always moving, and and there is a white eye in the part of the black of the yin, and there is a black eye in the part of the yang. That means they are communicating all the time, and they are affecting each other all the time. Come to the sleeping is the process of the yin energy goes to the yang, and when you wake up, it's continue moving until it get out of the yang, and it's the process of you fall into sleep and wake up. And when you have sleep problem, either you're hard to fall into sleep or wake up in between. That because the yin-yang relationship has problem. And the acupuncture use this theory to adjust the yin-yang relationship to make it back into harmony, smooth. Then you have a good sleep. When I talk about excessive heat in the heart, we are exactly talking about the subconscious. I'm happy you mentioned that. The subconscious supposed to be the yin part, supposed to be quiet and calm down while you are asleep. But because there is too much heat in that system, make it active. And so it couldn't calm down. It's still active, so make you keep thinking at night. When the main conscious already rests, this subconscious still kind of drink too much, still active. And so that's the part we have to treat. That's in Chinese medicine, that's overactive subconscious. We call that excessive heat.
Okay, I understand. Would you like to talk about one more presenting problem that your patients come to you for?
Do we have enough time?
Sure.
And another one I would say is the acid reflux. That's another thing I see a lot. Of course, this is food related. Some tomato-based food, high acid food does cause the problem. But in Chinese medicine, if your digestive is strong enough, you don't have the problem, no matter what food you eat. It can deal with some heavy work. And the reason people have acid reflux, I see, is they have a lot of stress. And some people even, they say, I try to avoid tomato-based food. I try to avoid spicy food. I try to eat plain. I still have acid reflux. That is because we could see insomnia. We talk about excessive heat in the heart. Now the acid reflux is excessive heat in the liver and the gallbladder. And the gallbladder is a fire organ. And when we're supposed not to taste anything of our organ, But when you have acid reflux, the sour you taste, sometimes the bitter taste, is the taste of liver and the gallbladder. That means they are overactive. And what we do is when a organ overactive doesn't mean they're overworking, they're working hard. That means they are, when we say overactive, it includes either working too hard or not working not hard enough. We are talking about functional disability of the organ. So maybe the Western medicine, the doctor check your enzymes, everything is still good, but functional wise, it's not as good. So for this kind of situation, we use some acupuncture treatment, some Chinese herbs, trying to cool down the gallbladder to clear the excessive heat in the liver. So that's another situation I see a lot recently.
Interesting. You know, and this may not be related at all, but I used to deal with divorcing couples and help them. And quite a few of them would talk about quite a few that had very small children, infant children. The infant children, especially when there was high conflict between the parents, they had stomach problems, and they were either throwing everything up, vomiting everything, or it was going the other direction. And my intuition was saying, this child cannot stomach what is going on in the family, and they don't have the cognitive ability to understand what's happening. All they can do is just react with their body to the stress that they're living under. So I'm wondering how much acid reflux is like somebody not being able to stomach something that's going on, and it's literally just coming up and related to stress.
Yes, you are very right. And I totally agree with your analysis. Stress totally mess up stomach. And we call that stomach chi rebel. Stomach supposed to be just a container of food. The stomach muscle supposed to have only one way movement is move down. When the stomach receive food, it will move it down, transfer to the small intestine, go through the whole digestion process. But when when the stomach doesn't function well, the stomach muscle instead goes down, it goes up, cause acid reflux. And who can make the stomach mess up is the liver. And the liver is the organ who deal with our emotion. So stress really, there is exactly a situation in Chinese medicine, we say the liver overacting on stomach, make the stomach muscle goes up. So then we feel acid reflux, we vomit. So it is, your thinking is really right. You link the right things together.
Again, it's an accident. Okay, well, I really appreciate your time. This is fascinating to me, and hopefully, and I'm sure it is fascinating to the audience. So I hope you'll come on regularly and we can talk about different things, different problems that people are experiencing. And it's such a wonderful gift what you're providing to people. So let me thank you for that contribution. It's clear that not only are you very capable and qualified, but you really care. So what a great combination to have and to bring to the world. So thank you for that.
Thank you so much, Mark.
So how do people um, communicate with you and reach out to you
Okay.
if they need some help and they're in the Tampa Bay area, or even if they're visiting, maybe you can help them a little bit.
Yeah, my office is in St. Petersburg, Florida, Pinellas County, and you can reach my office by calling 727-384-4826. It's 727-384-4826.
And you have a
To reach.
website?
Yes, I do have a website. Is www.dr.aprilwang.com.
Got it.
So,
We'll put that in the show notes. You know, it's
okay,
like
thank you.
you probably never go to your website, so you had to dig it up. Just like we never
Right.
call ourselves.
I'm kind of very traditional. Yes.
All right. Well, thank you so much. And this has been really valuable and very interesting. So I'll look forward to speaking to you again soon.
Okay. Thank you, Mark. Pleasure.
All right. Thank you. And everybody, thanks a lot. I won't go into details. There are lots of ways. If you want to find out more about Thrive Co-Living Communities, go to our website. Let me see if I can dig it up. www.thrivecoliving, no hyphen in it, communitiesplural.org. And there are many ways that you can support the podcast and our efforts, and those will be in the show notes below. I got that one right. And we'll also put Dr. You said Wang. You pronounce it Wang, not Wang.
Yeah, Wang.
That's the American way of saying it, probably. So,
Right.
All right. Thanks, everybody. We'll see you next time. Thanks for joining us for another great episode of the Thrive Co-Living Communities YouTube podcast. To learn more about our mission and how you can support our vision of creating co-living communities worldwide, please visit us at thrivecolivingcommunities.org. To receive advanced viewings of our podcast and other exclusive content, find us on Patreon at patreon.com/Thrive Co-Living Communities. You can also learn more ways to support our mission in the show notes below. Amazon Smile, GoFundMe, Kroger, and our own Thrive Gear store, where you can buy t-shirts, hats, and many other items. Thanks again for tuning in, and we'll look forward to seeing you again soon.